I would like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to talk about the 3 most common forms of treatment that are prescribed for vaginal atrophy, or as it's also commonly referred to as genitourinary syndrome of menopause, or GSM for short, and that would be the vaginal creams, and there are 2 of them. It would also be the vaginal tablets that goes under the name of Vagifem, and then also the vaginal ring. And so, as I've said in my previous videos, after I was diagnosed with GSM, my doctor decided to put me on the Vagifem 10 microgram tablets, which is the only treatment I've been on thus far for the treatment of my GSM. But I've also received some comments from some women who were prescribed the cream. And so because there are some differences between all 3 of those treatments, the cream, the tablet, and the ring, I just wanted to talk about some of those differences so that whether you are just recently diagnosed with this condition, or perhaps you've been on one of these treatments but you're thinking about maybe trying one of the other treatments, hopefully it will give you a little bit of information about what each particular treatment is, what any of the differences are, and then the side effects and things like that. And so I hope you'll enjoy the video, and I hope that you'll find it informative and maybe even hopefully answer some questions you may have. Local estrogen therapy treatments. Local estrogen therapy refers to a prescribed treatment that is being targeted at a localized area, in this case being the vagina. It is used for women who have been diagnosed with vaginal atrophy, also referred to as GSM, or other vaginal conditions. The 3 most common forms of local estrogen therapies currently available by prescription are vaginal estrogen creams, vaginal ring, Vagifem vaginal tablet. Estrogen creams. The 2 estrogen creams available by prescription are Estrace vaginal cream and Premarin vaginal cream. Is there a difference between the 2? Yes. Estrace contains only one form of a lab-made estrogen, being estradiol. Estradiol, E2, is a female sex hormone produced by the ovaries, adrenal gland, and also the placenta during pregnancy. It is a primary form of estrogen in a woman's body during her reproductive years. A woman's body uses the estradiol in a similar way to how it uses naturally produced estrogen. Each tube contains 0.01% estradiol. You can get it in either name brand or generic form. Premarin is a conjugated estrogen cream, meaning there are several different estrogens combined together, being estradiol, estriol, and estrone. The estrogens in Premarin are derived from a natural source, being the urine of pregnant horses, thus the name pregnant mare's urine, Premarin. Each tube contains 0.625% of conjugated, meaning combined estrogens. You can only get it in name brand form. The effectiveness, side effects, and drug interactions are similar between both brands of estrogen creams. However, the recommended dosages are different. Estrace is usually started at a higher dosage than Premarin and is lowered over a period of a couple weeks. The recommended starting dosage is 2 to 4 grams once a day for 1 to 2 weeks before being lowered to a maintenance dose, being usually 1 gram 1 to 3 times per week. Each tube of Estrace is 1.5 ounces, 42.5 grams, and comes with a calibrated applicator, meaning the applicator is measured in 1.0 gram increments with 4 gram capacity for delivery of 1, 2, 3, or 4 grams of cream. Premarin is usually started at 0.5 grams twice a week, followed by a cyclic regimen, meaning cycles are repeated. So you would use the cream twice a week for 3 weeks, followed by 1 week where you don't use it at all, then back to twice a week for 3 weeks, then repeat. Each tube of Premarin is 1.06 ounces, 30 grams, and is calibrated in 0.5 gram increments with a maximum of 2 grams. Estrogen levels tend to vary more when using these creams since it is difficult to measure the correct dosage using the applicator provided. This is because the applicators are designed for a higher dosage. It is recommended that you use less than the indicator shows that is sold with the creams. The lowest effective amount of estrogen is always best. This is something that you will want to speak to your physician about for further clarification. Common side effects for both Estrace and Premarin creams include application site reactions like itching, discharge, uterine bleeding, and inflammation. Both Estrace and Premarin come with a box warning, also referred to as a black box warning. This is due to the possibility of systemic, meaning affecting the whole body, absorption occurring. It is important to note that most of the studies show an increased risk after prolonged use, 5 years or more. Further, according to the University Behavioral Health of Denton in Texas, 40% of people are taking at least one medication that comes with a black box warning. These include common drugs such as Motrin, Advil, and Xanax. Further, serious adverse events are noted to be quite rare. It is important to do your research and go to your physician with any questions or concerns you may have. Vagifem 10 microgram tablets. Vagifem is a small white tablet that comes pre-inserted into a disposable white or blue applicator. Vagifem used to be available in a 25 microgram tablet, but as of July 30th, 2010, Noral Nordisk discontinued it, with it now only being available in 10 microgram tablets. This is due to the recommendation from medical societies that the lowest effective dose of estrogen, consistent with treatment goals, benefits, and risks for the individual woman, should be the therapeutic goal. Vagifem 10 microgram meets this requirement, which basically means 10 micrograms of estrogen inserted into the vagina is considered ultra low and yet still provides relief from the symptoms of vaginal atrophy, GSM. Vagifem 10 microgram tablets also come with a black box warning. The FDA requires that every estrogen-containing product come with a black box warning. Each Vagifem insert is 6 millimeters in diameter and is administered in a one-time use disposable applicator. The tablet contains 10 micrograms of estradiol. Side effects include headache, breast pain, irregular vaginal bleeding or spotting, stomach, abdominal cramping, bloating, nausea, hair loss, fluid retention, and vaginal yeast infections. It is directed to take one tablet once a day for 2 weeks, then one tablet twice a week after that. It is available in either name brand or generic form. Estrogen-infused vaginal ring. A string is a vaginal ring containing estradiol, of which is lab-made from an estrogen hormone. A string is inserted into the upper part of the vagina and left in place for 90 days or 3 months, after which time a new ring would need to be inserted that could either be done by you or your physician. Each string vaginal ring has 2 milligrams of estradiol in it. It slowly releases a very small amount of estradiol, being 7.5 milligrams per day for 90 days or 3 months. You can only get it in name brand form. Side effects include mood changes, breast lumps, unusual vaginal bleeding, unusual vaginal itching, odor, abdominal pain. Rings and tablets deliver approximately the same amount of estrogen, but creams may deliver more depending on how much is used and where it is placed. Each treatment comes with similar side effects and black box warnings. There are 2 articles I found regarding the safety of using local estrogen therapies and the black box warnings that come with them. Due to their length, I will include them in at the end of the video for you to pause the video and read if interested. So, which method, cream, ring, or tablet, works the best and which one is safest to use? Let's talk some statistics. According to drugs.com, Vagifem has an average rating of 6 out of 10 from a total of 95 ratings, with 47% of reviewers reporting a positive effect, while 35% reported a negative effect. A string has an average rating of 5.7 out of 10 from a total of 60 reviews, with 48% of reviewers reporting a positive effect, while 42% reported a negative effect. Premarin vaginal cream has an average rating of 7.2 out of 10 from a total of 20 ratings, with 63% of reviewers reporting a positive effect, while 21% reported a negative effect. Estrace vaginal cream has an average rating of 6.5 out of 10 from a total of 81 ratings, with 52% of reviewers reporting a positive effect, while 24% reported a negative effect. All 3 methods have a positive success rate in treating the symptoms of vaginal atrophy, GSM. Because each of our circumstances are different ages, different tolerances to medicines, different doctors, different health concerns, different symptoms, it's hard to group us all together when it comes to what treatment would work best. but at least we can offer some hope and encouragement by sharing our experiences with one another. Thank you for sharing yours. And so I know that was a lot to take in. Believe it or not, I could have put down a lot more information, but then I was worried the video would end up being too long and people would end up getting bored with it or lose interest in it. And so I just tried to keep to the basic, most important information that I felt women might be interested in learning more about as far as the differences between the three. And so I've done a lot of research on this, done a lot of reading on this. And it sounds like as far as the creams go, since the Estrace comes with a generic form, whereas the Premarin doesn't, the Estrace seems to be prescribed more often because it is more affordable. Both creams come with a very high rating as far as what women think of them. The only real downfall to them would be the fact that it's not a controlled amount. So in other words, the applicators are empty and then you have to insert the cream into the applicator. And so that dosage can change. Even if you think you're right on that line, it's still not a controlled amount. And so the concern of getting too much estrogen is there. And then also from what I've read, it can be messy since it's a cream. So sometimes it is going to leak out of the vagina. And so other than that, that seems to be, a good treatment form. I haven't read a whole lot about the ring. It doesn't seem to be prescribed that often. So if you're somebody who was prescribed it, I would love for you to leave a comment and kind of share your experience with that, since I'm having a hard time finding a lot about that. And then the Vagifem seems to be very popular, which is what I'm on. And that's that little white tablet that comes pre-inserted into the disposable applicator. It doesn't sound like the ratings are as high as the creams, but that's what I've used, and I can tell you the only side effect I've had, as I've said in my previous video, is a little bit of breast tenderness from time to time. Other than that, my body's tolerated it very well, and it's worked wonderfully. And yep, you can have the chance of it falling out if you don't insert it high enough, but after a few times of doing it, at least in my case, I got more comfortable with it, and so I knew the right depth to insert it so that pill would stay in place. And so a little bit less messier than the creams. And it does come in a generic form, so that makes it affordable. And so really, I think the two most common would be the creams and the Vagifem tablet. And again, I wasn't able to find a whole lot of information about the ring. And so as always, if you have any questions or concerns, if you want to just leave me a comment, I would love to be able to read them or answer any questions that you have. I think this is great, again, that we're talking about this and that we're able to share our experiences. Like I said in the video, even though our circumstances are different, we're of different ages, different healths, we have different symptoms. Obviously, we're going to have different treatments depending on what our doctors think would work best for us. I still think it's great that we can talk about this, and if something, let's say you're on the cream and you don't like it and you want to go to the Vagifem, hopefully my videos are at least giving you some information about that, so that when you go in to see your doctor, you're going to be a little bit more informed and you can have your questions ready for him or her so that you can have anything answered so you feel confident in the treatment that you're being prescribed. And so other than that, the next video I plan to do is going to be talking about why estrogen therapies are known to have your, as far as getting breast cancer or endometrial cancer, why it raises your chances of getting that. So I'm going to go into detail about that. But other than that, I just want to thank you so much for joining me today, and I will look forward to seeing you again next time.